هنتكلم معاكم عن Respiratory System Assessment. أهلا بيكم يا أبنائي. Our objective from this session will be regarding revise knowledge of anatomy and physiology, obtaining health history about respiratory system, list common manifestation of respiratory diseases, and the differentiation between normal and abnormal findings. Our outlines will be about anatomy and physiology. That will be started through the assessment of respiratory system position, lighting, and draping, and the physical examination that include 4 techniques: inspection, palpation, percussion, and auscultation. First of all, you know already that assessment anatomy of respiratory system will start from the nose, and then will go through the epiglottis, larynx, and then trachea, bronchial tree اللي هو البرونكاس والبرونكاي والبرونكيول والالفولاي, and then lungs. That lungs divided into loops: right loop and left loop. Right loop consisting of 3 loops, with left lung 2 loops. Each terminal bronchiole branches into respiratory bronchioles. The alveolar ducts are located at the end of respiratory bronchioles. The alveoli is the area of gas exchange that responsible about diffusion of O2 and CO2 between the blood and the lungs, and occurs across the alveolar membrane. There is also surfactant that is produced in the alveoli, and its primary functions are to facilitate alveolar expansion. يبقى عرفنا السرفاكتنت وجوده ايه او وظيفته ايه، ان هو facilitation للالفولار expansion. تمام كده؟ ده just picture showing the right and left lung loops, and this is the structure of respiratory tract. As we see here that there is cilia covering the inner side of the trachea and bronchi, and this cilia is responsible about the expelling of dust and particles or any foreign object that will enter through the trachea if it is entered. Our definition about respiratory examination is performed as part of a physical examination or when a patient presents with a respiratory problem, including dyspnea, cough, chest pain, or a history that suggests a pathology of the lungs. يبقى أي history من respiratory problems ديت يبقى indicates pathology inside the lungs. Respiratory system clinical examination. The clinical examination comprises history taking, a physical examination that include inspection, palpation, auscultation, and percussion, and the evaluation of laboratory data and radiological findings or diagnostic tests that will be done for the respiratory system disorders. The physical examination will include clinical history and clinical features. The clinical history will include personal history, as we know already that we have to take age, name, marital status, education, occupation of the patient. It's very important to identify what are the factors aggravating or what are the factors is aggravating the symptomatology of respiratory problems. بعد كده بنشوف برضو تاني خطوة مننا ان احنا بناخد الباست ميديكال هيستوري، والباست ميديكال هيستوري لاني diseases that the patient had, whatever it was, cardio problems or respiratory problems or diabetes mellitus or endocrine disorders. Also will take the past surgical history. ده رقم 3. واي عملية بيعملها البيشنت لازم بناخدها من امتى حصلت. This is very important. And then past family history, and we will collect the data regarding any hereditary diseases inside the family that affecting the respiratory history or the respiratory disorder. The 5th one of clinical history is a smoking history. As we know before that how many packs this patient is smoking, and the frequency of the smoking and what type of the smoking, if it was cigar or electronic smoking. Also, we have to collect the data regarding the history of present complaint as chest pain or dyspnea or cough with productive cough or sputum or in unproductive cough. The assessment of respiratory system, also including the second one part, is including clinical signs and features of respiratory diseases. You know, we had many problems as a clinical feature of respiratory diseases. The first of one of them is cough. You know already cough. Cough is a reflex. It was not abnormal. بس امتى يبقى abnormal؟ لو it was persistent. Allah. So we have to identify and assess the types of cough, if it was dry cough or productive cough. This productive cough associated with the sputum, we have to know or assess the amount of the sputum, the consistency, and the color of the sputum. If it was purulent or green color, that indicate that there is bacterial infection. Also, we will collect the data regarding the clinical signs of sputum. That sputum varies in amount and character according to the nature and extent of the lung disease. The third feature is composed of hemoptysis, and that hemoptysis varies in severity and ranges from slightly streaking of the sputum with blood. If it was at the beginning, which is a common symptom in acute and chronic bronchitis. But if it was a massive hemorrhage, this one is indicating bleeding from the bronchus or from the lung, and this massive hemorrhage we can estimate it as 2 cups of blood or sputum with blood, or more than 200 cc of sputum with blood. The first one, clinical features or clinical signs, is dyspnea. You know already dyspnea is, what is the meaning of dyspnea? Is difficult in breathing, or it can be defined as a perception of uncomfortable breathing. It should be distinguished from hyperpnea or tachypnea. This hyperpnea where the minute ventilation is increased but no abnormal sensation is felt. But tachypnea, an increased respiratory rate. This means that it was more than 20 cycles per minute. We had another one, is the fifth one, is for the feature is cyanosis. This cyanosis is a fluid discoloration of the skin and the mucous membrane, which occurs when desaturated hemoglobin exceeds 5 gram per 100 ml. وده طبعا بنعرفه من تحليل السي بي سي وتحليل الاتش بي، بنقدر نعرف قد ايه من الهيموجلوبين. اذا كان البيشنت ده عنده انيميا بيبقى عنده بالتالي نسبه تشبع الهيموجلوبين بالاكسجين قليل، وبالتالي بيبقى محتاج enhancement او improvement ب O2 inhalation. We had 2 types of cyanosis, peripheral cyanosis and central cyanosis. peripheral cyanosis معاه normal SaO2 saturation، لكن السنترال cyanosis بيبقى معاه abnormality في SaO2 or O2 saturation. 6.1 of clinical signs and features is chest pain. This chest pain caused by diseases of respiratory system, frequently originates from involvement of the parietal pleura. Chronic or recurrent chest pain may reflect pulmonary vascular or pleural disorders. We know when we will start to do assessment of respiratory system, we have to position the patient in a suitable position, and he should be set in upright position on the examination table. The patient's hands should remain at their sides. When the pack is examined, the patient is usually asked to move their arms forward, themselves position, hug themselves position, so that the scapula are not in the way of examining the upper lung fields. Also, lighting adjusted so that it is ideal. Draping the chest should be fully exposed. Exposure time should be minimized. As we see here from physical examination of the respiratory system, we had respiratory rate and rhythm. As we know here, that's the normal rate of respiratory at the resting time is from 12 to 20 cycle per minute, and it should be regular rhythm of breathing. And we have to inspect the movement of reps during inspiration and expiration, and we will note the bulking and the depression in intercostal areas. مفهوم كده؟ Abnormalities of respiratory rate and rhythm. There is abnormality in respiratory rate and rhythm as bradypnea if it was less than 12 cycles per minute, and abnormal slowing of respiration. Tachypnea when the breathing was more than 20 cycles per minute. It may be caused by severe pain, chronic pulmonary or cardiac diseases, or anxiety. Apnea, cessation of breathing. Hyperpnea and increased depth of breathing. Metabolic acidosis and use of accessory muscles during inspiration. This is the illustration about the slow breathing and the tachypnea. It's shaped like that. Inspect the cardiac pulsation also, especially epigastric pulsation, because emphysema hidden all cardiac pulsation except epigastric pulsation. Number 10 بنعمل inspection للانterior والposterior chest for lesions, scars, pigmentation and deformity in the back. Okay. As we see here that there is a thromboplasty وهنا في kyphosis, and this abnormality can affect over the respiratory system assessment. بالنسبة لتاني حاجة بقى ان احنا بنعمل palpation، والpalpation ده we had to rub hands together to warm them علشان ما يبقاش ايه الكولدنس بتأثر على السكين اثناء assessment of respiration. بنعمل palpation للنك وبنعمل palpation for assessment of lungs. For the palpation of neck we have to identify if there is tracheal deviation, and the normal finding that the trachea is a midline structure and should lie equidistant between the clavicular heads. Palpation for the assessment of tracheal length, we will use 3 middle of the patient's hand from cricoid to suprasternal notch. Normal finding, we will assess the tracheal length is 3 fingers in COPD patients. The chest is parallel and the trachea is short. You know here that the third one for the palpation, we will do palpation for supraclavicular areas for lymph nodes assessment, and if we found that there is enlargement of lymph nodes in supraclavicular area, ده بيبقى indication in there is a tumor or sarcoid doses above the clavicle. As we see here in this picture, we can see supraclavicular. These nodes are examined using digital compressions just superior to the clavicle. Palpate skin for tenderness, mass, character of musculature and status of costal parts. And so why we will do assessment for the tenderness and the mass and the character of musculature and the status of costal ribs? If passes nodule or tumor is present, note feel for shape, size and consistency. We can see here from this picture that in anterior chest we can assess for the during the inhalation and exhalation if there is the two thumb is near to each other or not. This is the normal, but in abnormal we will find that there is no symmetry between right and the left side during inhalation and expiration. For the posterior part of the back, we can see here also the vibration of the chest during inhalation and exhalation. For assessment, the third picture here is showing the tactile firmness. This tactile firmness is indication for the assessment of at the specific points is showing inside this video. Auscultation. We have to assess the breath sounds. Ask the patient to breathe in and out slowly and deeply through the mouth. begin at the apex of each lung and zigzag downward between the intercostal spaces, and we will listen with the diaphragm of portion of the stethoscope. يبقى احنا بنستخدم ايه؟ الdiaphragm of a stethoscope to in zigzag method to assess the breathing sound. We can see here from the illustration, using the diaphragm of the stethoscope, we will do auscultation of the chest at the specific point. At the specific point from the anterior part of the chest and from the posterior part of the chest. We will compare the corresponding areas on each side. We will note and document the presence and the location of the sound, and type of sound, and the duration and the intervals between sounds. So here, to assess the normal breath sound, we will assess the bronchial, that is the same calling is tracheal sound. We will hear it over the trachea and the main stem bronchi. Second to fourth intercostal spaces either side of the sternum anteriorly, and third to sixth intercostal spaces along the vertebra posteriorly. The sounds are described as tubular and harsh. نيجي بقى على bronchovehicular. والbronchovehicular بيبقى normal heard over the major bronchi below the clavicles in the upper of the chest anterior. In the upper of the chest anteriorly. The bronchovehicular sounds heard over the peripheral lung node pathology. The sounds are described as medium pitch and continuous throughout inspiration and expiration. We can see here from the illustration bronchial over tree, bronchial sound, the green color, then bronchovehicular over main bronchi, as we see here the bluish one, and then we will do assess the vesicular sound over the lesser bronchioles and lobes of the lung. Also, we will assess for the normal breath sound for the vesicular sound heard over the peripheral lung, described as soft and low pitched, best heard on inspiration. Diminished heard with shallow breathing, normal in obese patient with excessive adipose tissue and during pregnancy. يبقى إذا لما أسمع diminished sound أسمعه في البريجننت 1 وبسمعه الديمينشد ديت في الأوبيس 1. خلاف كده بيعتبر abnormal لو أنا سمعته في الأدلت. إذا لو سمعته أنا في الأدلت إن هو diminished يبقى ده indicate للobstructed airway أو partial or total lung collapse or chronic lung or chronic lung disease. We had abnormal breath sound that we are calling it as what affects the bronchial tree and alveoli may produce adventitious sound, and this one is divided into two categories: discrete non-continuous sounds as crackles, continuous musical sounds as wheezes. اخر حاجه بقى اللي هو البركشن، زي ما احنا قلنا في الترتيب نخلي بالنا كويس ما ننساش الموضوع ده. inspection, palpation, auscultation, percussion. اخر حاجه percussion في respiratory system assessment. بنعمل assessment للdirect percussion used infrequently only for percussion of the clavicle. ده direct percussion. اما indirect percussion to anterior thorax symmetrically percuss the anterior surface and we will do percussion from 2 to 3 strikes along right lung apex, and we will repeat on left lung apex. We will proceed downward percussing in every other intercostal space going from right to left in the same position on both sides. Normal percussion is resonant. لازم نخلي بالنا برضو ان الصوت بتاع النورمال percussion للريسبيراتوري سيستم بيبقى resonant over all the lungs except over organs الهارت والليفر بيبقى dull. هنشوفها في الصور اللي جايه ان شاء الله. والكاردياك dullness is present at the third to fifth intercostal space left to sternum. نشوفها مع بعض بعد كده، بس نعرف ايه الفرق ما بين الابنورماليتيز والنورمال. الابنورماليتيز اوف percussion بيظهر هايبر ريزونانس ودنس وفلاتنس. لو ظهر هايبر ريزونانس indicate emphysema. اما الدنس indicate pulmonary infiltrations and pleural thickening. الفلاتنس indicate pleural effusion. تمام كده. من هنا نقدر نشوف من الالستريشن او الفيجر ده نقدر نشوف الدايفراجما اوف ايه اوف percussion areas and sounds in the anterior. الاستومك البركشن ارياس ده تمباني، الليفر دنس، عند الكاردياك بيبقى دنس برضو زي ما قلنا قبل كده، وفوق الكلافيكال بيبقى فلات ساوند ديو تو بركشن، والريزونانت اوفر لانج تيشو بسمع الريزونانت طبعا عشان مرور الهواء. بنشوف هنا الباك برضو posterior part of the back، فوق السكابيلا بيبقى فلات، في اللنج بيبقى ريجينانت، في اللنج بيبقى ريجينانت، وتحت من اللنج بيبقى فيزيكرال فليتنس. تمام كده. بعد كده اللابوراتوري انفستيجيشن we have to use know that the most common laboratory investigation in respiratory system الهيموجلوبين and hematocrit. وطبعا احنا عارفين ليه بنقيس الهيموجلوبين ليه؟ لان احنا عارفين ان الهيموجلوبين محمل بذرات الاكسجين، واحنا عايزين نعرف الاوتو ساتوريشن دي جايه من البرونكاي ولا جايه، لو هي قليله بيبقى جايه من الهيموجلوبين ليفل ومستواه في الدم ولا لا. تاني حاجه من اللابوراتوري انفستيجيشن هو الالكترولايت امبالانس والارتريا بلاد جاز. والارتريا بلاد جازز هنا يا جماعه يا ابنائي الاعزاء تفتكروا كويس ان البي اتش من 35 ل 45. لما باجي احلل الارتريا جازز ارتريا الاي بي جي بحلل البي اتش وبحلل البي سي او 2 والبي او 2. البي او 2 من 80 ل 100 ملي هيوج. اما البي سي او 2 البي سي او 2 من 35 ل 45 ملم هيوج، والاتش 2 سي او 3 من 22 او 24 الى 28 ملي ايكويفالنت. الديagnostic تيست هنا بقى بيبقى بنعمل تشيست اكس راي ونعمل كمبيوتر توموجرافي سيتي سكان عشان تو اسس التيومرز الابسس الابورتيك انيوريزم تو ايدنتيفاي باللورال افيوجن also. Magnetic resonance imaging also to identify alteration in lung tissue with pulmonary function test by to assess vital capacity and forced expiratory volume in 1 second. بكده يبقى احنا خلصنا الريسبيراتوري سيستم اسسمنت، وبنقول نبتدي اسئله علشان الكويشن 1 which one of the following is composing lower respiratory tract. تقدروا تجاوبوا معايا. نوز، تراكية، لانج، الفولاي. ها الإجابة الفولاي طبعا لأن هو ده اللور، أما الأبر بيبقى النوز والتراكية. طيب how many respiratory rate what are the how much respiratory rate أو how many respiratory rate normal value 10 to 20 cycle per minute ولا 12 to 20 cycle per minute ولا 15 to 20 cycle per minute ولا 16 to 18 cycle per minute. طبعا الإجابة B. Which one is abnormal respiratory sound through auscultation؟ إيه الabnormal respiratory sound؟ طبعا wheezing sound من الصورة ديت، يبقى الإجابة C. طيب نشوف السؤال الرابع. When the patient has a sputum what should the nurse assess؟ طبعا the nurse should assess what؟ الهيستوري. بشوف الهيستوري اوف سبيوتم بقاله قد ايه، والبدايه ايه، والكميه كانت ايه، وكانت لونها ايه، واصبحت دلوقتي ايه. ده بالنسبه للهيستوري. بشوف برضه هيستوري اوف كف قبل كده وكان معاها سبيوتم ولا ما فيش. بالنسبه للفيزيكال اكزامينيشن بشوف في الفيزيكال اكزامينيشن بشوف انسبكشن للكلر اوف ذا سبيوتم، وبشوف بسمع auscultation علشان to identify which loop had a sputum أو secretion inside أو stages of secretion inside the lung، وبشوف برضو الcolor والconsistency of the sputum. طيب question number 5 identify the EPG values and name the test of pulmonary function test. وأعتقد أن أنا لسه قايلها لكم في الإجابة في آخر سلايد. أي سؤال؟ شكرا جزيلا لكم وإلى اللقاء مع سيستم آخر.